All right. Well, welcome to another edition of Parent to Parent. Thank you so much for joining us. We're talking about a very popular and important topic: the when Roe v. Wade was overturned recently, and there's been a lot of discussion how this is going to affect women, the economy, and one of my friends is actually an obstetrician gynecologist. To be real with you, her biography is really long. I mean, it's very impressive. I was just reading it like it's this, she's a board certified in reproductive endocrinology and infertility by the American Board of Obstetrician Gynecologists. She was I was reading about something that she was named one of the rising stars in New York. And I really do encourage you to look at her biography because your brain will hurt because you'll be like, whoa. So she's joining me now. So Dr. Rashmi Kadesia, thank you so much for taking the time to do this. I know you're very busy. So we're going to dive right into it. So what did you think about Roe v. Wade being overturned?
Yeah, I mean, it's one of those things that we've known for a while it could happen and felt like it was, imminent to come. But I think, the day that we actually got the alert that it had been overturned after 49 years, I think it was still really shocking. And, I would say my gut feeling as somebody that has lived her entire life in a world where reproductive choice was kind of an assumption. Most of us that are in their reproductive years have lived their entire life in that world, right? So anybody that is less than 49 years old has only lived in a world where Roe v. Wade was the land of the law. And so I think that, only now are people starting to really understand the ramifications of that. As an OBGYN, we consider reproductive health care to be just like any other part of healthcare. And it's really unfortunate that, it's become so politicized, and so from our perspective, anything that results in government interference in the relationship between a physician and their patient, whether it's a woman or a couple or an individual, is something that I would say I'm pretty much unequivocally against. I think healthcare decisions should be made by people that can understand the nuance of the situation. And I know we'll get into it, but this is not a cut and dry area of medicine. There's a lot of gray areas. And even people that think that they know how they feel about the issue, if you pose them certain, circumstances or situations, might think, okay, well, in that scenario, it's okay. But if you take a hard and fast law or rule, then you don't have that ability anymore to say it's okay. And that puts a lot of people at risk of their care being delayed or their life even, being threatened in certain circumstances.
Definitely. And so, I'll be honest, I didn't really know what all ramifications this could have in detail. I mean, obviously, there's those that are pro and con. Those that are obviously pro-life, they argue that they're giving life or they're giving these children opportunities. So do you feel, just as a person, not wearing the doctor hat, do you feel that the majority of people who, well, even in your experience, that decide to take that route are doing it as more of a contraceptive, or are they doing it more as, they need it medically or they can't provide for their child?
Yeah, so I think it's a mix. The majority of people that get pregnancy terminations or have an abortion already have children. And so these are not folks that are necessarily, the stereotype is people are just being irresponsible, and I think that that's not a fair representation of who gets abortions for a variety of reasons. First of all, birth control can fail. And so plenty of times it's people that were actually being quite responsible and their birth control didn't work. And that's a known risk, first of all. And, on top of that, it's birth control costs money and you have to be able to access it. We are in a country with, a primary care shortage. A lot of times people can't get in to see their physician to get a birth control refill or whatever. I think we've all potentially been in a situation where we call the gynecologist's office in a panic. Oh my God, I'm about to run out. And they say, well, great, come on in. But our next appointment's in 2 months, And so then what do you do in that time frame, And people are trying to be responsible, but birth control fails, condoms break. And there are plenty of people that have medical contraindications to being on hormonal birth control, or that, they're not able to have reliable contraception placed, or God forbid, there's a situation of rape or incest or a variety of other circumstances. So there's definitely no way to generalize to say that people that get pregnancy terminations are being irresponsible or could have prevented it, unless nobody's having intercourse. I mean, if we're saying that people just shouldn't have sex, then okay, that's one thing. But plenty of heterosexual married people are having pregnancy terminations, and so I think that's just kind of unrealistic.
Yeah. And do you think, have you gotten questions from your patients about this?
Oh, absolutely. So, I mean, my day to day, I'm a fertility doctor. So, I'm primarily working with folks, whether they're straight or single or gay or whatever the situation is, but, they're trying to build families. And there are ramifications for all of us when it comes to this, because even when folks are trying to become pregnant, 1 in 4 to 5 pregnancies that starts ends in a miscarriage. And there are ramifications for how miscarriages can be handled based off of, what's come out of the overturning of Roe v. Wade. And so, even in Texas, it's become a lot harder to manage miscarriage since then. We have pharmacists that refuse to fill appropriate medications. We have pregnancies that implant outside of the uterus are not viable pregnancies that, again, pharmacists or hospital staff are not sure if they can be treated. And so, people are being put in life threatening situations of their care being delayed, et cetera, et cetera. And so, I always try to remind people that even folks that are trying actively to have a healthy baby are being negatively impacted by this. I'm getting asked multiple times a day, how is this going to impact my fertility journey? What if I have a pregnancy that turns out to be, abnormal from some genetic standpoint? Now what? How can I act upon that? And again, we live in a country with, healthcare circumstances where if you end up in a situation with a complicated pregnancy and potentially a sick baby, you may not have good healthcare insurance to cover all of that. And who's going to pay those bills? And who's, going to be there to take care of that child? So it's very strange to call yourself pro-life when really what you're doing is forcing people to potentially have babies that our society doesn't do a good job of taking care of. And so that I think is the part that gets me. I think if we were focusing on all of these things together to say, yes, well, we want to improve our healthcare coverage situation. We want to improve prenatal care. We want to have childcare. We want to, have all of those things together. That would be a platform I could at least understand and find to be internally consistent. So I think that's how I would view that.
Yeah. And what about the future of doctors when you're talking about specialties and, obstetrician gynecology, that's a specialty. I have to say that I recently was at U of H. They have a new medical school and they are gearing towards, and this was one of the big things with Tillman Fertitta because he donated a bunch of money, and also Dr. Renu Couture, about making sure that there's a lot more primary care physicians because that's what we locally need. I know that there's a nationwide shortage, but locally, like going into those communities. And so, what do you feel about, obviously we also need, doctors like you. And so what does that do to your profession and how does that affect your profession?
Yeah. So, basically, the management of an early first trimester abortion and the management of a miscarriage are very similar. Whether it's treated medically or whether it's treated surgically, those are similar procedures. And so, when we restrict what's able to be done from a, medical perspective, that also impacts the training that folks that go into OBGYN get. And so, residents in states like Texas that are going into OBGYN are now going to have far fewer opportunities to manage these things and refine their skills during their training. And as a result, down the line, if that becomes a persistent issue, then they may be less equipped to manage the things that are going to happen normally, as a result of people having unprotected intercourse and wanting to have children. There's going to be miscarriages. There's going to be ectopic pregnancies. And in a situation where there's fear and confusion and misconceptions around all of this, it becomes harder to train physicians accordingly. Many folks are going to say, well, maybe I don't want to go into women's healthcare. If it's such a political landmine, if the government's going to have my hands tied behind my back, maybe that's not something I, want to do. And there are already so many deserts in not only our state, but across the country where there's not enough OBGYN care as it is. And many reproductive age women use their OBGYN as their primary care doctor. So I agree with you. There is a shortage of primary care physicians, absolutely. But, I think OBGYN is often part of primary care, and many folks don't get a primary care doctor unless they have some other medical diagnosis or they're a little bit older. And so, when you talk about discouraging people from being able to practice the full breadth of their specialty, there's a lot that goes into that. And, again, as a fertility specialist, many of my patients, and I mean, honestly, even myself, are worried about where the next step is going to come right now. Is there going to be threats to our ability to pursue things like IVF, because we typically create extra embryos as part of that process? And if folks start to press for those embryos to count as people, is that going to restrict what we can offer our patients? So are we actually going to go backwards in success rates for fertility treatments? So these are all things that absolutely could impact the choice that a young medical student or physician in training might make about what they want to do with their future.
Yeah, definitely. Well, I want to show this graphic that I thought was really interesting. The total number of abortion providers are down since 1982. That keeps decreasing. I have seen both with the CDC and other reports just about how the number of abortions is actually increasing. So I was going to ask you what you thought about that, and if you're seeing that same trend.
Yeah, so I mean, it's hard to fathom, but in the 1970s, when Roe v. Wade actually passed, this was not as political of an issue. And even now, it's important to state that a majority, well over 50% of Americans support, the type of abortion that constitutes the vast majority, 90+%. First trimester pregnancy termination is supported by the majority of Americans. And so again, this is a minority kind of imposing their views on the rest of us. So that's important to recognize. But aside from that, in the 70s, this was not a controversial issue. As it's become more politicized, the number of people that want to be mixed up in all of that. I mean, we've had abortion providers assassinated, right? And so, of course, it's understandable. I mean, we're mothers, right? Like, you have to weigh, what you're willing to do, right? Even if you feel in your heart that it's the right thing and you're providing desperately needed healthcare, does that come at the expense of the safety of your family? That is a choice that abortion providers have had to make now that they didn't have to make in the past. And so it's not surprising to me that although the need is going to be there always, and we've seen that across the world, that no matter what a country does to try to restrict abortion, it always happens. It's just a question of whether it's going to happen safely. So I think I'm not surprised. The number of providers is going to go down, and it's going to keep going down if there's less abilities to train. Yet the need or the desire is not going to go down. And we've seen that in Texas, obviously since the passage of SB 8 last fall, that there are still equivalent numbers of people that need pregnancy terminations that are now trying to travel or get medication through the mail or whatever, to try to control their own reproductive futures. So that's just kind of a reality of life as human beings.
Yeah, definitely. And what's scary is I actually spoke to somebody, and I was going to do a story with her later, but like back in the 1970s, I guess, when she was or 1960s, when she was in school, she because abortion wasn't legal, so she created this, like, I guess, abortion clinic in her dorm room. And I mean, a lot of people did that, like underground, she's scared that that's going to happen again. And just recently in the news, we talked about how a doctor is wanting to open up this floating abortion clinic in the Gulf of Mexico.
Yeah.
And I mean, it's like, where do you go because it feels like just someone looking at this, like we're going backwards, like we're not moving forward in medicine and in terms of choices, obviously, that people have. When healthcare is like the number one thing for everybody, right? Having the best health that they can. So, I mean, a floating clinic, I mean, abortions, underground abortions, people are going to still get abortions, right? Like, don't you feel from the people that you've talked to, just from the research that I've done and the doctors I've spoken to, they're like, well, people are still going to get abortions.
Yeah.
It might not be legal, but it's going to be unsafe.
Yeah, it is. I mean, that, again, this is not a hypothetical question. This is a data backed observation from over decades in every country that has ever tracked that data. And if you look at what's happened to Texans that wanted terminations, since SB 8 passed in the fall, what's happened? Those that are able to afford it. And again, remember, most of these women have children. So what does that mean? If you have to go to New Mexico or whatever, some other state, you either bring your child and then find childcare there, or you arrange childcare locally. Not everybody has all of these options, right? You have to get time off of work now to travel. There's a lot of logistics that make it actually that much harder. And so you have to plan all of these things. So now you're having those that have the least resources to be able to have another child are the ones that are most likely to have to continue that pregnancy. So that's one thing, which is, again, totally backwards. I read this article that said that since SB 8 passed in the fall, those babies are just the forced birth babies. They're just beginning to be born now because we're at about 9 months later. And, I was looking at profiles of 18-year-olds, that didn't have the resources or the support to be able to go out of state or whatever. And now they're an 18-year-old dropping out of school with a baby. These are the stories that are going to happen. However, if you can afford to travel, now your termination is also pushed by a couple of weeks, probably because you had to arrange all of that. And so it becomes inherently a more dangerous and more advanced procedure. And so some of these first trimester abortions are becoming second trimester abortions because and therefore more unsafe as a result of political interference. And the risk of complications goes up. Still, much less lower risk of complication than actually having a baby, mind you. But it's more difficult, and now you have to travel. If something comes up later, it's not like you have your doctor that's down the street that you can pop in for a visit or call them as their established patient, for a quick question. So it's horrible. It's a horrible way to do healthcare, and of course I applaud everybody that's trying to think creatively about the solutions. But, abortion is a very safe procedure when done properly. And yet if we sort of conscript women into having to have it on a boat, in a dorm room, in a back alley, of course, the chances of complications are going to go up. And some of these women are going to have life-threatening consequences or lose their fertility. And, the children that they may want to have in the future are never going to be born as a result of that. So, what about that? And so, I think it's a really short-sighted decision, and we're going to start seeing the ramifications of that very soon.
And having an abortion, you have to, once you travel, you also need to stay there, right? Because it's not like a go there, get it done, come back. You don't drive back. Especially for people in Texas, it's a long drive.
Yeah. I would not recommend that.
Right.
I'm sure plenty of people have. They're probably bleeding and uncomfortable and, trying to drive. Again, desperate people will do whatever the situation requires. I have zero doubt, that people have tried to do that. But otherwise, yes, you're racking up hotel fees and transportation fees for staying somewhere longer or having somebody come with you. There are, abortion funds that exist. That can try to help people with those funds, but not everybody's aware of those resources. Not everybody's able to access them. So, I wouldn't pretend that it's like a perfect scenario, but yeah, obviously it's not ideal. And I think that there's already no question about.
Yeah, definitely. Well, Dr. Kudasia, thank you so much for talking to me about this and all of us. And, it's definitely a conversation that continues to be had just in all the developments that are happening. So thank you so much for your time. I know that you're very, very busy. And I just want to thank all of you for joining us for this segment of Parent to Parent, all of our Facebook followers, YouTube, also on our website. Next week, we'll have another topic that we'll be diving into. Be sure to let me know on any of my social media pages if you want to suggest a topic. I'm always all ears for all of that. And hopefully, we'll get through all this together.